The fluorescent lights hummed their mechanical dirge overhead as Ashley Cooper pushed through the ICU doors at 11:48 p.m., her scrubs still damp from the evening rain outside Seattle General. The antiseptic smell hit first, that sharp chemical bite that never quite masked the copper undertone of blood and human suffering. She'd been breathing it for 3 years on night shifts, long enough that it no longer registered as unpleasant, just as the baseline of her world. Her left leg ached from the old fracture, the one that officially came from a car accident in 2015, and she favored it as she walked toward the supply station, her gait favoring a weight distribution that 15 years of field medicine had burned into muscle memory. The ICU was quiet at this hour, that particular kind of quiet that only exists when the dying are sleeping. 6 beds, 4 occupied. A ventilator wheezed its mechanical rhythm in Bay 3. Cardiac monitors beeped in steady syncopation, a percussion section for the orchestra of managed decline. Bay 1 held a 72-year-old with sepsis. Bay 2, a car accident victim with a femoral fracture. Bay 4, pneumonia. The usual midnight roster of the body's failures. Ashley's hand drifted to her jacket as she passed the break room, a habit so automatic she barely noticed it anymore. Her fingers found the seam, traced the outline of the faded patch sewn into the lining. Special Forces emblem. Unit designation faded to near invisibility after 7 years of being hidden. The patch was the only physical proof that Major Ashley Cooper had ever existed at all, and she wore it every shift like a talisman, like penance, like a promise to the operation that had been buried along with her records. Evening, Coop. Marcus from the day shift was finishing his charting at the nurse's station, his voice carrying the particular exhaustion of someone who'd been managing critical patients for 12 straight hours. He was young, maybe 26, and he still looked shocked every time a patient coded. He'd learn. They all learned, eventually. Morning in 2 hours, Marcus, she said, her tone measured, careful. Deferential. Never presumptuous. The art of being invisible in plain sight had taken her 3 years to perfect at Seattle General, and she'd spent 14 years before that perfecting it under different circumstances. How's Bay 1? Lactate still climbing. Sepsis protocol is running, but his family's asking about comfort care options. Marcus closed his laptop. Caldwell was in here about 2 hours ago. Told them to wait another 24 hours. He didn't use those words, but that's what he meant. Ashley nodded, made no comment. Dr. Caldwell was the chief of critical care, a man whose last name matched his personality precisely, cold, hard, capable of fracturing things with minimal effort. He'd been the attending physician since the old chief retired last spring, and in the 8 months since his arrival, the entire ICU had reorganized itself around his whims like iron filings around a magnet. He was competent, which made him dangerous. Competence without compassion was a scalpel with no guard. I'll check his numbers in 20 minutes, Ashley said. Get some rest. Marcus left, and she settled into the familiar rhythm of night shift. Vitals checks. For site inspections. Ventilator management. The kind of granular clinical work that nobody saw, that the day shift assumed had always been done, that Dr. Caldwell never explicitly thanked anyone for completing. This was the invisible work. This was where competence lived when nobody was watching. But Dr. Caldwell was watching. Not tonight. Tonight he was somewhere else, probably at home, probably reading medical journals or taking calls from people who mattered more than she did. But tomorrow morning at 6:15 a.m., he would arrive for rounds. And that was when things began to shift. Ashley was in Bay 2 at 6:09 a.m., adjusting the femoral fracture patient's pain medication, when she heard his voice from the hallway. Dr. Caldwell's voice carried the particular timbre of a man who'd never been told no by anyone who could make it stick. It sounded like authority seasoned with contempt. Night shift documentation is typically adequate at best, he was saying to someone, probably one of the residents. The nursing staff here does competent technical work. That's all we should expect. Their role is not to think. Their role is to execute the protocol as designed. The words landed with precision, calculated to carry far enough that the nursing staff would hear them. Ashley's hands remained steady on the 4 pump. Her jaw didn't clench. Her breathing stayed measured. The trembling wasn't fear. The trembling wasn't anything. She was granite. She had learned long ago how to become granite. Dr. Caldwell entered Bay 2 with 2 residents trailing behind him like pilot fish behind a shark. He was tall, 6'3", and he used his height like a weapon, positioning himself slightly closer than comfortable, tilting his head down when he spoke to nurses as if addressing children. His last name fit. Everything about him was hard angles and sharp edges, the kind of face that came from a family of lawyers and politicians and men who'd never had to earn a single thing. Ms. Cooper. He didn't use her first name. None of them did. I'm reviewing the overnight fluid balance on this patient. Why did the night shift order an additional 500 milliliters of normal saline at 0300 hours? The protocol specifies 250 milliliters per hour maintenance only. Ashley turned from the 4-pump, her expression neutral, professional. Patient's urine output dropped to 0.3 milliliters per kilogram per hour at 0245 hours. MAP was trending toward 60. Small fluid bolus was appropriate to maintain perfusion to the kidneys. I documented the rationale in the chart. One of the residents, a woman, maybe 28, looked at the chart. Look back at Caldwell. A small shift in the room's gravity. Caldwell's smile was a scalpel. You ordered a medication without an attending's approval. That's not your decision to make. That's not your job. Your job is to recognize abnormal values and report them. The attending makes the clinical decision. Next time, call me instead of playing medicine. The patient's creatinine is 0.9. Down from 1.2 yesterday, Ashley said. Her voice was quiet. Composed. The kind of composure that came from surviving things Caldwell would never understand. The bolus worked. He's perfusing his organs. Caldwell leaned forward, his chest nearly touching hers, his voice dropping to a register that only the people in the room could hear. I don't care if your clinical instinct was correct. I care that you exceeded your scope of practice. You're a nurse. You execute orders. You don't create them. Is that clear? The resident stared at their shoes. The monitors beeped. The ventilator wheezed. Ashley's eyes met his, direct, unflinching, calm as a sniper's breath before the trigger, and she said, "Clear, doctor," and something flickered across his face, a microsecond of uncertainty, as if he'd expected her to flinch and she hadn't. Caldwell finished rounds in the remaining bays and left. The residents followed. And then the break room began to empty as the day's shift arrived. Ashley was sitting with a cup of coffee, cold by then, forgotten from sometime after midnight, when the nurses started to filter in for shift change. She watched them arrive, watched them see her, watched their expressions contract like flowers closing at dusk. They gathered their personal belongings. Nobody made eye contact. Nobody sat down. "Morning, Ash," someone might have said, but nobody did. The silence was deliberate, coordinated, the kind of social excommunication that only worked if everyone participated equally. A break room that went quiet when she entered. A lunch she ate alone. A shift where nobody asked for her clinical input on difficult cases, nobody consulted her on patient management, nobody treated her as anything other than a body to move patients from place to place. It wasn't overt enough to be actionable. It was careful. It was the kind of silence that could exist in a professional environment indefinitely. Ashley finished her coffee, rinsed the mug, and walked toward the ICU. Bay 1 was getting worse. The sepsis patient's lactate had climbed again despite the protocol, and his eyes had that particular glassiness that meant he was starting to shut down. She was reviewing his latest labs when the ICU doors opened at 6:51 a.m., and security escorted in a stretcher moving fast. Incoming from emergency transport, the paramedic called out. 78-year-old male, acute cardiac event, defibrillated once en route, currently stable but critical. Bay 5 is ready. The patient was unconscious. The paramedics were moving with the controlled urgency of people who'd seen something serious. Ashley was already moving toward Bay 5 to prepare the monitors, the medications, the equipment, when she looked at the patient's face and felt something stop in her chest. She recognized him. 4-star General Marcus Holloway. The man who'd sat on the panel that court-martialed her. The man who'd buried Operation Crossfire so deep that the only record of it left was the patch sewn inside her jacket. The man who'd ordered her into hiding 7 years ago because what she'd seen in Marja couldn't be allowed to exist in any official capacity. And now he was lying unconscious in her ICU at Seattle General in Raleigh, North Carolina, 2,847 miles from anywhere he should have been. The room went dead silent. 2 nights before the general's arrival, Ashley pulled the chart during the 2,300-hour shift when the unit was quietest. The fluorescent lights overhead cast everything in that particular shade of institutional white that made shadows look like bruises. She was doing routine medication reconciliation when the notation caught her eye. Not buried deep. Not encrypted. Just there in the treatment protocol section, flagged with a Pentagon routing stamp and a single word, classified. Chemical agent exposure. Nerve agent class. Post-exposure prophylaxis protocol. The medications didn't match anything civilian, they were military-grade, Pentagon-sourced, the kind of thing you only saw in theater protocols she hadn't looked at in 7 years. Her hands moved through the rest of the chart on automatic. Vital stable. Organ function declining in specific patterns. Then the notes section. A name. Senator Richard Bancroft. Flagged 3 times across the medical record. Treatment authorization tied to his office. Her breath came careful and measured, the way she'd learned to breathe when the world was trying to kill her. She understood what she was looking at. This wasn't a medical mystery. This was a cover story. Someone had exposed the general to something illegal, and someone else was making sure the exposure stayed buried. The treatment protocols were designed to heal him without leaving evidence. Pentagon-level resources, congressional cover, medical records that would be scrubbed before morning if anyone noticed. She closed the chart. Logged out. Walked to the break room and poured coffee she didn't want, hand steady as a surgical laser even though her pulse had moved to somewhere around 127 beats per minute. The coffee smelled like hot pennies and despair. The next evening, she was reviewing the same chart when Caldwell appeared in the doorway of the medication station. His presence made the air pressure change. She felt him before she saw him, that particular kind of predatory stillness that comes from knowing you have institutional power and no one to answer to. Interesting reading. His voice was level. Curious. Which meant dangerous. Ashley looked up. Medication interactions. The propofol dosing seems high given his renal function. His renal function is not your concern, Nurse Cooper. Caldwell's jaw was doing something subtle, some tiny muscle working beneath the skin. In fact, this patient's entire medical history is beyond the scope of your access. Do you understand what I'm saying? Yes, doctor. He held her eyes for 3 seconds, long enough to make sure she knew he'd seen her lingering near the general's chart. Long enough to let her know the next moves were already in motion. Then he turned and walked away. She watched him head toward his office. 30 seconds later, she heard him on the phone. Yes. Pentagon routing. I'm flagging an access violation. No, I'll handle it personally. Yes, I have her file here. His office door closed, but his voice carried through the thin hospital walls like something that refused to be contained. Morning rounds came with the sun bleeding orange across the ICU windows. Ashley was 3 minutes into checking for patency on a septic patient when Caldwell appeared with rounds, the general's daughter among them, a woman who wore her colonel's rank like armor, her husband standing stiff beside her, both of them looking at the machines keeping the general's heart in rhythm. Nurse Cooper. Caldwell's voice had that particular timbre of performance in it. The kind of tone doctors used when they wanted an audience. Since you're so curious about things above your pay grade, perhaps you can explain to the colonel here why you've been asking inappropriate questions about her father's medical history. The room contracted. Ashley felt it happen in the drop in air pressure, the way everyone's breathing synced. The colonel's daughter turned. Her husband's jaw tightened. A resident who'd been standing near the monitor suddenly became very interested in his shoes. Ashley set down the flush. One measured breath. She didn't flinch. She didn't blink. When she spoke, her voice came out flat and even, the voice of someone who'd held far worse men together while they died. I asked about medication interactions, doctor. Standard protocol for RN responsibilities. She met Caldwell's eyes and held them. One tear escaped, not from emotion but from the particular kind of pressure that comes when you're standing in front of your own erasure. She wiped it without breaking contact. I was doing my job. The colonel's daughter made a small sound, something between acknowledgement and uncertainty. Caldwell's face had gone rigid, his jaw working like machinery. He knew. The way she'd answered, the specificity, the calm, the absence of apology, it had told him everything. She wasn't just a nurse asking routine questions. She was someone who understood exactly what the chart meant. "We'll discuss this later," Caldwell said, and his voice had changed. The social attack had failed. Now he was moving into something else. Something more calculated. By the next shift, the break room had become a geography of absence. Ashley sat at the table with her turkey sandwich and noticed the conversation stopping mid-sentence like someone had cut the audio feed. 4 nurses were gathered by the coffee maker, Rodriguez, Kim, Jackson, and Martinez, people she'd worked beside for 18 months. They looked at her the way people look at someone who'd just become contagious. "We're heading back to floors," Rodriguez said quietly. The others nodded and moved past her without eye contact. One of them muttered something under her breath, barely audible, but it carried Caldwell's blacklist. Ashley ate her sandwich. The bread felt like cardboard and copper in her mouth. Her hands didn't shake. That was the strange part. Her hands had held 3 patients' hearts through defibrillation, had pressed against arterial bleeding with the kind of pressure that stopped death, and now they sat perfectly still on the table next to a sandwich she wasn't tasting. The trembling wasn't fear. It was restraint. She watched the nurses leave. Watched the break room clear until she was alone with the hum of the refrigerator and the sound of her own breathing. This was how it worked. Caldwell didn't need to fire her. He just needed to make sure no one would work alongside her, talk with her, defend her when the real attack came. Isolation first. Then erasure. The next morning, a notice appeared on the unit board where all staff gathered for updates, schedule changes, policy memos, disciplinary actions visible to everyone with eyes to read. It was printed on official letterhead. Her name right there, not Nurse Cooper but the formal The Nurse A. Cooper, written warning, inappropriate questions regarding patient backgrounds. Boundary violations. Under review for transfer. A crowd was gathered when she arrived. She watched them read it. Watched them glance at her and then away. The silence was so thick you could operate in it. She stepped forward and read the notice herself. Her vision didn't blur. Her voice didn't crack. She simply turned, found Caldwell standing in the corridor watching for her reaction, and said 4 words that made his face go pale: "I've treated worse men for better reasons." His jaw clenched so hard she thought his teeth might break. Then he turned and walked toward his office, pulling his phone from his pocket before he'd even reached the door. Within minutes, she heard him making calls. 3 in sequence. First to hospital administration. "Yes, we need to accelerate the shift optimization for the ICU nursing staff. Nurse Cooper needs to be transferred before the end of the week, if possible. Operational efficiency concerns." Second call to a number in the 202 area code, DC. "This is Dr. Caldwell at Seattle General. I'm reporting a potential credential fraud case. One of our nurses appears to have an employment gap prior to 2021. The paperwork looks incomplete." And then the third call, the one that made everything clear, the Pentagon routing number she'd memorized from the chart. "Sir, I flagged a security concern. The nurse who accessed the general's file, I'm handling containment. The new schedule posted by noon." Effective in 48 hours, Nurse A. Cooper transferred to Mercy Point Satellite Clinic, 14 miles across town. Different unit. Different patients. Different building. Far enough away that she wouldn't have access to the general's room, far enough that she couldn't protect him from whatever Caldwell was orchestrating. That evening, she tried to run the general's evening rounds. Her ICU badge, the magnetic stripe she'd swiped 1,000 times, beeped red at his room entrance. Access denied. A security guard appeared within 8 seconds, his hand resting on his belt, his posture suggesting this wasn't his first interaction with Caldwell's directives. Dr. Caldwell left specific instructions, the guard said without apologizing. "You're not authorized for this patient." She looked at the general through the glass door. Still unconscious. Still breathing the hospital's recycled air. Still the man who'd signed the court-martial paperwork that had erased her. Still the man she was bound by oath to save. Back in the locker room, she found her jacket hanging where she'd left it that morning. She unzipped the interior lining, a small seam she'd maintained for 7 years, never letting it come fully open. The faded unit patch came away in her fingers, the Special Forces insignia worn nearly invisible from years of handling it in the dark. This was all that was left. This small piece of fabric that proved she'd ever been anything other than just a nurse with gaps in her employment history and inappropriate questions. The patch was the only proof. The only evidence that Major Ashley Cooper had existed, that she'd spent 12 years in the 75th Ranger Regiment, that she'd survived 3 days behind enemy lines in Marja, that she'd come out with intelligence that mattered. The military had erased her after Operation Crossfire, her record sealed, her name classified, her service buried so deep that even she sometimes wondered if she'd imagined it. Caldwell was trying to erase her again. Different method. Same result. She held the patch in her palm. Felt the weight of everything it carried. The oath she'd taken said she would serve with honor and protect those who couldn't protect themselves. The same oath said she would save any life in front of her, regardless of circumstance. The general had buried that operation and everyone connected to it. He'd done it to protect something worse than one dead soldier. He'd done it to protect interests that went all the way to the Senate. And now he was dying in her hospital, and she had 48 hours before she was too far away to help him. Her phone buzzed. A text from the unit manager, transfer paperwork moving forward. Your last ICU shift is Friday 1900 hours. She looked at the unit patch in her hand. Looked at the small rectangular mirror hanging in the locker. The person looking back didn't look like a nurse anymore. She didn't look like anyone who'd ever learned to disappear. She looked like someone who'd just understood that some oaths couldn't be buried, no matter how hard people tried. Dr. Caldwell sat in his office at 2:24 a.m., the fluorescent overhead casting his face in a pallid glow as he opened Ashley Cooper's employment file for the 3rd time that night. 3 years of impeccable work history. Perfect evaluations. 0 disciplinary issues. And then, nothing. A 7-year gap that the hospital's background check had somehow flagged as verified prior employment without specifying where or what she'd actually done. He scrolled through the digital file, searching for something that wasn't there. Education records terminated at age 18. No college transcripts. No certifications from any civilian nursing program. Just a sudden appearance at Seattle General 3 years ago, as if she'd materialized from nowhere. He leaned back in his chair, fingers steepled against his chin, his mind working through the implications like a chess player studying an opponent's weakest squares. A nurse with a 7-year employment gap didn't simply vanish and reappear unless someone had made her disappear. The intercom on his desk buzzed at 4:15 a.m. Caldwell had already anticipated this. He'd been waiting for the general's condition to stabilize, waiting for the moment when Ashley might have time to think, to connect the pieces she'd glimpsed in that classified file. He couldn't allow that. He opened his hospital administrator credentials and pulled up the ICU scheduling matrix, his fingers moving across the keyboard with the precision of someone who'd spent 23 years learning how to manipulate institutional systems from the inside. The master schedule glowed before him, a grid of names, dates, and shift rotations that governed who had access to which patients. He highlighted Ashley's upcoming week and began the systematic removal. Thursday night shift move to pediatric satellite clinic. Friday move to the urgent care facility in Chapel Hill, 40 minutes away. Saturday, blocked entirely. Then he rerouted her Monday and Tuesday ICU assignments to respiratory support training at the County Medical Center, a full day's commitment that would place her 60 miles away from Seattle General during the General's post-stabilization observation period. By the time Caldwell finished, Ashley had precisely 4 hours of ICU coverage in the next 8 days, all of them scheduled when the General would be under continuous attending supervision, surrounded by other staff. She wouldn't be alone with him. She wouldn't have access to the medical records. She wouldn't have time to cross-reference the chemical compound markers that had appeared in his blood work, the ones that tied directly to a contracted trial sponsored by a sitting senator's brother-in-law. Caldwell saved the schedule and sent it through official channels, flagging the changes as routine staffing optimization and clinical cross-training. No one would question it. No one ever did. At 6:42 a.m., he dialed the number for hospital administration. The hospital director picked up on the second ring, still home, still drinking her morning coffee. Caldwell's voice came through warm and concerned, the voice of a man who was doing the hard work of protecting his institution. He explained that he'd noticed some irregularities in Ashley Cooper's employment history, nothing alarming, just something that would benefit from a thorough review. He mentioned, gently, that her background check appeared incomplete. He suggested, diplomatically, that perhaps a lateral transfer to one of their satellite clinics might be the prudent path forward, not a punishment, just an administrative realignment. The director listened. The director agreed. By 7:15 a.m., transfer paperwork had been initiated, the language carefully constructed to frame the move as professional development rather than removal. Minor discrepancies in employment verification requiring additional documentation, the memo read. Recommend temporary assignment to Chapel Hill Care Center pending clarification. Caldwell hung up the phone and opened the email chain containing the classified briefing on the General's medical history. He deleted the message from his inbox, then his trash folder, then wiped the automatic backup. He was good at making things disappear. He'd learned from the best, from people who understood that some information was too dangerous to exist, that some truths required institutional erasure, that survival in certain circles meant knowing which levers to pull and when to pull them. He'd been pulling levers for a long time. Ashley understood the pattern by 8:11 a.m. She stood at the medication dispensary on the ICU unit, refilling her crash cart supplies for the night shift, when the newly posted schedule caught her eye. Thursday night, pediatric satellite, 40 miles south. Friday, urgent care, 60 miles away. Her jaw tightened, not a visible reaction, barely a pause in her movements, but every instinct honed by 3 years of Special Forces training recognized the signature of a calculated removal. Not a dramatic firing. Not a public accusation. Something quieter. Something that would dislodge her from the General's proximity before she had time to weaponize what she'd seen in those files. She pulled the unit patch from the inside of her jacket lining, turning it over in her palm for just a second where no one could see. The emblem was faded but intact, the crossed sabers and lightning bolt of Special Forces Command, sewn into jacket lining because official uniforms could be confiscated, but a needle and thread could make proof that never left your body. Caldwell had made his moves with precision, the schedule rearrangement was textbook strategic sabotage. Not crude enough to trigger complaint, not aggressive enough to raise flags, but calculated down to the minute. He was trying to run out the clock. He was trying to create distance before the General woke and asked for her. He was trying to ensure that by the time the transfer paperwork made its way through administration, by the time she was officially reassigned to Chapel Hill, the General's situation would be either resolved, one way or another, or buried so completely that her testimony would mean nothing. She understood something else, too, something that made her grip on the crash cart handle tighten to the point where her knuckles blanched. Caldwell hadn't just been making calls to Pentagon numbers during his bathroom breaks. He'd been building a narrative. A nurse with mysterious employment gaps asking questions about classified patients. A nurse who might destabilize things if she had access to information she shouldn't have. A nurse who suddenly became a liability the moment she proved she already knew too much. The systematic schedule rearrangement wasn't administrative convenience. It was a countermeasure. It was the work of someone who understood that Ashley Cooper represented exposure, not just to a chemical agent trial, but to something bigger, something that reached beyond the general, beyond Caldwell, into the upper structures of the Pentagon and the private contractors who fed on gray zone military contracts. She'd spent 7 years trying to disappear into the life of a nurse because that was what she'd been ordered to do. Disappear. Integrate. Become someone who asked no questions and attracted no attention. She'd done it perfectly. She'd been invisible. And now, because she'd glimpsed something she wasn't supposed to see, because she'd recognized a patient she'd been conditioned to forget, the machinery was working to make her invisible all over again, but this time not from the world, but from this hospital. From the general. From the evidence that could connect everything back to what happened in Marja, back to Operation Crossfire, back to the intelligence she'd recovered that cost 3 soldiers' lives and saved 200 coalition lives and got her officially erased because some truths were too expensive to let live. She placed the crash cart supplies in order: epinephrine, atropine, amiodarone, sodium bicarbonate, each medication in its precise location, her hands moving with the muscle memory of someone who'd organized trauma kits in field conditions where hesitation meant death. The pattern of Caldwell's moves wasn't just tactical. It was desperate. It was the behavior of someone who'd already decided what outcome he was willing to accept and had begun moving heaven and earth to ensure it. The general had 48 hours, maybe 72, before he was moved to a regular medical floor or discharged. After that, Caldwell's problem would disappear on its own. The chemical agent story would stay classified. The trial would stay buried. The senator's brother-in-law would stay clean. Unless someone stopped it. Unless someone understood what was happening and moved first. Unless someone who'd already survived 3 days behind enemy lines and 1 court-martial and 7 years of professional death could find one more reason to break the rules that were breaking her. The fluorescent lights hummed their standard frequency above her head as she secured the crash cart in the medication alcove. 8 hours until her night shift. 8 hours until the general's post-operative medications would cycle. 8 hours until she would be positioned to observe every vital sign, every medication order, every strategic choice that Caldwell would make about a patient he needed to either save quietly or lose catastrophically. She pulled her scrubs tight and felt the unit patch move against her ribs, still there, still proof, still waiting for someone brave enough to let it speak. The cardiac monitor's shriek split the ICU at 0300 hours like a siren cutting through fog. A flat line stretched across the screen, thin, accusatory, absolute. Ashley was 3 doors down when she heard it, her hand still carrying the weight of the previous patient's vitals, her mind already cataloguing the next 4 hours of night shift. Then the alarms. Then the rushing. Then the silence that comes before everything changes. She moved toward the general's room on instinct, the muscle memory of 1,000 emergencies pulling her forward. What she found stopped her breath. Dr. Caldwell stood at the bedside, staring at the monitor the way a man stares at something he doesn't understand, frozen, calculating, paralyzed by the sudden absence of control. The attending resident was fumbling for the crash cart. The nursing staff hovered in a doorway like extras in a scene they hadn't rehearsed. Nobody was doing anything. The general's heart had stopped, and the room had stopped with it. Caldwell turned as Ashley approached, his eyes flickering with something that looked like relief, as if he'd been waiting for someone else to decide what came next. That hesitation cost him everything. Ashley didn't ask permission. She didn't check credentials or hierarchy or any of the protocols that had been ground into her for 3 years of humiliation. She moved like water finding a crack, sudden, unstoppable, inevitably downward. She shoved past Caldwell with her shoulder, her body language carrying a kind of authority that made the attending resident step back without thinking. The crash cart had a scalpel in the instrument tray, still sterile in its sealed package. She opened it the way she'd opened 100 sealed packages in a field hospital in Marja where the tent walls flapped in the wind and the wounded came faster than the body bags could accommodate. 15-degree angle, she said, not to anyone in particular, just speaking the numbers aloud as her hands moved. Anterior thoracic wall, between the 5th and 6th ribs. Her voice had changed. It wasn't the careful, deferential voice that Caldwell had spent 3 years training into submission. It was the voice of someone who had held human hearts in her hands before, who understood that hesitation was a luxury only people with time could afford. I need an 18-gauge needle for the pericardium. Now. The resident moved. The surgical tech moved. Even the nursing staff, still hovering in the doorway like ghosts, moved. They didn't know who she was. They didn't understand the authority in her tone or the precision in her movements. But they recognized it anyway, the way prey recognizes a predator, not through conscious thought but through something older and deeper. The scalpel cut clean. The incision opened like a mouth. The pericardium was there, exactly where it should be, exactly where she knew it would be because her hands had done this before and her hands never forgot. The general's ribcage opened. Ashley's fingers found his heart, a fist-sized muscle that had stopped firing, a pump that had lost its rhythm. She began the compressions, her palms pressed against the myocardium, her shoulders driving the motion with the kind of controlled force that comes from training repeated 10,000 times until thinking becomes irrelevant. Manual cardiac massage. Open cardiac compression. The kind of procedure that belonged in a trauma bay in a combat zone, not in a civilian ICU in Raleigh, but the general's body didn't care about location or protocol. It cared about pressure and oxygen and the stubborn refusal of a trained hand to accept that failure was inevitable. Push 1 milligram epinephrine, Ashley said. The words came out like commands because they were commands, and the attending resident pushed the drug without checking the order, without looking at Caldwell, without doing any of the small things that might have broken the spell of competence that had filled the room. Charging paddles to 360. The defibrillator hummed. The general's body arced once, twice, the electricity moving through him like lightning through a tree. The monitor's flat line continued. Ashley didn't stop compressions. Her hands kept moving in the rhythm of life itself, systole, diastole, pressure, release. Pain was information. Pain meant something was happening. Silence would mean failure. The clock was running. 15 minutes without blood flow to the brain and the man on the table would still be breathing, but he wouldn't be there anymore. The consciousness would be gone, leaving only a body that moved and nothing that drove it. Continue compressions, she said. A resident stepped forward and took over the compressions, and Ashley moved to the monitor, watching the electrical patterns, the waveforms that told the story of a heart trying to find its way back to purpose. The attending was pushing medications on her instruction now, a second dose of epinephrine, amiodarone, atropine, the full ACLS protocol moving through the general's veins like soldiers following orders they trusted without question. Caldwell had backed toward the wall. His hands were at his sides. His mouth was slightly open. He was watching Ashley the way a chess player watches a move he didn't see coming, calculating what it meant, understanding in that slow, sinking way that he had lost control of something, that whatever he had been managing to contain was no longer contained. The monitor's rhythm shifted at 0313 hours. A blip. A pattern that wasn't flat line. Another blip. The electrical activity was returning, slow and irregular but returning, the heart beginning to remember what it was supposed to do. Ashley's voice came steady and cool, continue compressions. Slow the rate to 80 per minute. By 0315 hours, the general's heart was beating on its own. The oxygen saturation climbed, 78%, then 82, then 88. The carbon dioxide was normalizing. The color was returning to his face, a pink flush replacing the gray that had claimed him 15 minutes earlier. The attending resident was checking pupils, marking reactivity, already calculating the damage, already trying to project how much of the man would return to the man. Prepare for transfer to ICU, Ashley said. She was looking at the monitor now, not at Caldwell, not at the attending, not at the staff gathering in the doorway with phones already out, already recording the moment when everything they thought they knew about the hierarchy shifted. Get him on continuous telemetry. I want blood cultures before any antibiotics. His procalcitonin will be elevated, but I need baseline inflammatory markers. Stat. The orders came out with the weight of someone accustomed to being obeyed. The room moved around her like a school of fish turning on instinct. Nobody questioned. Nobody hesitated. Nobody called for confirmation from Caldwell. The attending resident was already relaying orders through the phone, already moving the general toward intensive care, already operating in a world where a nurse in blue scrubs had somehow become the person whose instructions determined whether people lived. Caldwell stood alone at the empty bedside. His jaw was tight. His hands had formed fists. He watched Ashley follow the stretcher out of the room, watched her hand off the patient to the ICU team with a list of medications and observations that made the night shift charge nurse snap to attention. She didn't look back. She didn't acknowledge him. She simply moved forward into the next moment, carrying the weight of a man she had pulled back from the edge of nothing, carrying the knowledge that she had just saved the life of the man who had destroyed hers, and carrying the absolute certainty that Caldwell would spend every resource he had left trying to make sure nobody ever found out exactly what had just happened. What she didn't know, as she walked toward the break room to document the resuscitation, was that Caldwell was already on his phone. By 0600 hours, termination papers would be filed. By 0800 hours, the state medical board would have a formal complaint. By noon, Caldwell would be sitting in the hospital director's office with a presentation prepared, credential fraud, unauthorized procedures, a psychiatric evaluation ordered, all of it documented, all of it strategic, all of it designed to erase the moment when a nurse had performed surgery on a 4-star general and saved his life in the process. The war between them was no longer hidden. It had moved into the light. And one of them was about to lose everything. By 0600 hours, Dr. Caldwell had filed the termination papers himself. Unauthorized procedures performed by uncredentialed staff. He typed each word with surgical precision, each accusation a scalpel cut. The hospital's legal team would have his back, they always did. Caldwell was the kind of doctor who knew how to weaponize bureaucracy, how to turn procedure into punishment. He'd been a surgeon long enough to understand that the quickest way to kill someone wasn't a blade. It was paperwork. By 0800 hours, he'd made the call to the state medical board. His voice on the phone was steady, concerned, the tone of a mentor disappointed by a protege's fall from grace. "I have serious concerns about her credentials," he'd said. "No verifiable history. No licensed training we can confirm. Last night she performed open cardiac massage without supervision, without proper authorization. I believe she's a danger to patients." The board representative had assured him they would investigate immediately. Caldwell knew how long investigations took. He knew how much damage could be done in the interim. By 1200 hours, he was sitting across from the hospital director in the administrative wing, 17 stories above the ICU where Ashley had saved a general's life. The director was younger than Caldwell, newer to power, eager to appear competent and protective of institutional integrity. Caldwell understood this type of leader intimately. They feared liability more than they feared injustice. "I'm recommending her immediate removal," Caldwell said, his hands folded on the mahogany table like a man delivering grave news. "Psychiatric evaluation and possible credential fraud. We have a duty to our patients. Her employment history prior to Seattle General is completely absent. No references. No verifiable positions. Either she's engaged in fraud, or she's experiencing a psychological break severe enough to fabricate an entire professional past." He leaned forward slightly, the gesture of a concerned colleague. "I wouldn't bring this to you if I didn't believe we had a serious problem." The director had nodded. Already reaching for his phone. Security arrived at 1400 hours with the kind of bureaucratic courtesy that made everything worse. Not an arrest. An escort. A precaution. The official reason cited in the paperwork was investigation into her suspiciously absent employment history prior to Seattle General. Nothing about the thoracotomy. Nothing about saving the general's life. Just the gap, the missing years, the void that Caldwell had strategically identified as weakness. Ashley had simply nodded when they came for her. No tears. No protest. She'd seen enough institutional machinery in the military to know when the outcome was already decided. The security officers had actually seemed uncomfortable, which suggested Caldwell hadn't told them the full story. They probably thought she was a fraud, a fake nurse playing dangerous games with people's lives. They didn't know she'd intubated patients in field hospitals. They didn't know her hands had sutured arterial bleeds with dental floss and a headlamp in a bombed-out clinic in Helmand Province. They knew nothing. She'd turned in her hospital badge at the administrative office, watching the security guard scan it one final time, the beep registering her erasure from the system. Then they'd walked her to the parking garage, the fluorescent lights casting everything in sickly yellow, their footsteps echoing off concrete like judgment made audible. She hadn't said a word the entire way down. That evening, Ashley was alone in the hospital laundry facility, hands plunged into her industrial washing machine, folding her blue hospital scrubs one final time. The fabric was still warm from the dryer, soft from 1,000 washings, and as she folded each piece, sleeves inward, bottom hem up, the way she'd learned to fold them 3 years ago during her first week, she could feel the weight of those 3 years pressing against her chest like a sandbag across ribs. The fluorescent lights hummed their mechanical dirge overhead. The smell of detergent hung thick in the air, medicinal and suffocating. Outside, Raleigh was dark and wet, rain hammering the small windows of the laundry room with the rhythm of a helicopter rotor wash, and for a moment Ashley almost smiled at the irony. The irony that she'd spent 7 years in hiding, changed her name on paper, taken a position 2 pay grades below her actual qualifications, lived in a studio apartment and ate off plastic plates, all to disappear so thoroughly that even she sometimes forgot who she actually was. And Caldwell had unraveled it all in 3 hours by simply asking the right questions. Her reflection stared back at her from the dark window, a woman in scrubs she'd no longer be wearing, her hair pulled back tight, her face the particular shade of empty that came from accepting an outcome she'd seen coming from 1,000 miles away. She'd treated worse men for better reasons. That's what she'd said in the break room. And she'd meant it. She meant it now. The faded unit patch was still in her jacket pocket, folded small enough to fit in the palm of her hand. She'd touched it 100 times today, the fabric thin as old paper, the emblem almost completely worn away by 7 years of being hidden. She was reaching into her locker to retrieve her jacket when the building's windows began to rattle. Not rain. Not wind. The sound was unmistakable once you'd heard it, a specific frequency of rotor blades pushing air in a pattern that turned wind into force. The sound built like distant thunder, grew louder, multiplied. 1 helicopter. Then 2. Then more. The lights in the laundry room flickered with each pulse of the rotors, and Ashley felt something shift in her chest, a recognition happening before her brain could process what was actually happening. The windows rattled harder. Dust shook loose from the top shelf of the storage closet. The sound was everywhere now, so loud you couldn't think around it, and Ashley stood frozen for exactly 3 seconds with her hospital scrubs in her hands and her badge in the return bin behind her, listening to the rotor wash shake the foundations of Seattle General like judgment made physical. She turned toward the window just as the first helicopter descended into view, its spotlight cutting through the rain like a blade, the word stenciled on its fuselage reading 160th Special Operations Aviation Regiment in letters that belonged to a world she'd burned behind her 7 years ago. If you've made it this far, you already know you're the kind of person who appreciates stories about the ones nobody sees, the quiet warriors, the people who save lives in the dark and ask for nothing in return. So hit that subscribe button right now, like this video, and comment below, have you ever been underestimated by someone who didn't know who you actually were? Because Ashley's story isn't over. Not by a long shot. And the next 3 hours are going to change everything.